generally the patients, once you have abdominal cancer, it is a very scary word, and the patients generally have a very dire sort of attitude towards it, thinking that the abdominal cancers have very poor prognosis and the life is very short. It is partly true for some cancers like pancreatic cancer, stomach cancer, gallbladder cancer are some of the abdominal cancers in which despite diagnosing at the right time and giving very good quality treatment, multimodality treatment of surgery, chemotherapy, radiotherapy, despite all these things, the survival is not good. But colon cancer is not like that. In fact, I will say, so in cancer, the success rate is measured by 5-year survival. So when we do a surgery for a group of patients, how many of those patients are surviving at 5 years? So for something like a stomach cancer, it could be 30%. Something like a pancreatic cancer, it could be 40 to 50%. That means you do a surgery for 100 patients, 50 of them are alive at 5 years. So if you're alive at 5 years, that means you're mostly cured of the cancer. It's never going to come back. Likewise, for colon cancer, these 5-year survival is up to 90%, especially stage 1, 2, 3 colon cancers. We have around 90 to 95% is the 5-year survival rate. So the long-term success, the cure rates of colon cancer are excellent. Why? One is the surgeries become very evolved for colon cancer, very safe, with very high success rates, and then the chemotherapy for colon cancer is also evolved a lot. So chemotherapy for colon cancer is very, very effective in preventing recurrence of the cancer. And in addition, you have drugs like oxaliplatin, 5-FU, irinotecan, which are very effective drugs to prevent colon cancer. And in patients in whom these drugs don't work, and in case they have some residual cancer or the cancer come back, we have excellent treatment called targeted therapies. Targeted therapies means, see, your regular chemotherapy has a very broad spectrum of action. It kills all cells. So you have hair loss, intestinal mucosa is affected, leading to ulcers and diarrhea and all those problems. While targeted therapies, so you have drugs like bevacizumab, cetuximab, and these kind of targeted therapies which specifically target growth factors within the tumor to control them. So for colon cancer, you have these kind of specific targeted therapies, which we do some genetic testing on the tumor. Once we take out the tumor, we do MSI testing, microsatellite instability testing, and KRAS mutation testing on these tumors, and then we decide which patients are candidates for this targeted therapy. And in those patients, these targeted therapy have led to vast improvement in the long-term cure of colon cancer patients.